a rough prep, unclear margins, and a super wide space for a lower anterior tooth. An impossible case to make look perfect, but we're gonna do the best we can with the data that we have. So little margin adjustments on this case. Clearly there's some inaccuracies there, and quite often cases like this lead to having to rescan and redesign. I end up mirroring the lateral on the contralateral side to mimic the shape and the width. I do make some slight adjustments here, both buccal and lingual and mesial and distal. Once I adapted, I saw that it really gouged out that distal line angle. So I end up undoing that and then ended up converting this to a Pontic, which I use quite often if I want to maintain the contours of the tooth that I'm using. This allows me then to go into free-forming, pre-adaption, and get the contours that I want. And then when it adapts, it doesn't really stretch or distort the tooth. So right here, I'm free-forming, getting the contours in more or less the position that I want. And once I've done that, I'll bring this up into occlusion a bit more. It's impossible to close the diastema in this case, so at this point I just want to make a lateral that sort of blends in nicely and is gonna be is gonna look as good as it possibly can. We'll make the virtual wax up bottom and then adapt it and create an anatomic wax up. So from here on that distal area where it adapted, we've got a bit of extra bulk. So I'm gonna smooth it a little bit. And again, splitting the difference between maintaining my nice contour and line angles, but also making sure that it's not ultra bulky and gonna end up trapping food. So some final free forming here and then merge and save. And is it the most beautiful result in the world? No, but the best we can do in a compromised situation.